Hi, my name is Annie. I'm actually a student nurse level 1.
Oh, hi, Annie. I'm Robin.
I understand that you're working on a patient right now?
Yes, I am.
Can I get an SBAR report from you?
Sure. The patient I'm currently taking care of is a 67-year-old male. He's full code status. He was recently admitted to the hospital because he has a non-healing wound on the lateral aspect of his right heel, and he's also been having some trouble controlling his blood glucose. So that's been a bit of a concern for him. I know that he's on a diabetic diet with a calorie control of 1,800 calories, and he's also on a restricted sodium diet.
Okay.
So let's see, for the wound, we just gave him some morphine, and he said that that was helping with his pain levels, so we're just going to let that continue. And then since we just took a glucose reading for him at about 1645, which was 290, that's a bit high. So I'm going to go ahead and give him some insulin to help control that.
Okay. Now, why specifically is this client receiving the medication?
The client's a type 2 diabetic, and since he is having some trouble controlling his blood glucose, we're going to want to give him the insulin just to keep that glucose level down.
Okay. And what action does the insulin have on the body?
The insulin is sort of like blood glucose's best friend, so they think about it as they like holding hands a lot. So you inject the insulin into the patient, and the insulin will go and will grab onto the glucose and help pull it into the skeletal muscle cells and the adipose tissue. And it actually helps control the production of glucose in the liver as well.
Okay. Now, when should you question administering this medication?
Well, you definitely want to check the glucose level before you give the medication. You want to make sure that it's not too low. The normal range for blood glucose is 70 to 115. And if it's within that range or lower, you definitely want to abstain from administering the insulin just because you can make your patient hypoglycemic. And another time you would want to not give the medication is if your patient's exhibiting signs of hypoglycemia, which are being cold and clammy, diaphoretic, so if they're sweating a lot, if they're confused, any of those are just major hallmark signs of hypoglycemia, so you're going to want to abstain.
Okay. Does this medication have a therapeutic serum level?
This particular insulin with this patient, we're giving it to him on a sliding scale, so it doesn't really have a therapeutic serum level that you're trying to maintain.
Okay. And what vital signs do you need to monitor?
Well, you definitely want to monitor the respirations, the heart rate, because those will slow down when you have hypoglycemia. You definitely want to make sure that you're checking the blood pressure, pretty much all the vital signs, oxygenation, that sort of thing.
And then which physiological parameters should be monitored when the medication is being administered?
Physiological parameters are probably going to, well, definitely the blood glucose. You definitely want to make sure that they're alert and oriented, they're not confused, they're not acting strangely, because that could be an indication of hypoglycemia.
Okay. Now, what interventions must be taught to the client to ensure that the medication is being administered safely in the hospital setting?
Well, we definitely want to make sure that the patient's aware of what medication they're taking and why. So if someone comes and tells them that they're taking a different medication, the patient should be able to question that just to make sure they're not getting the wrong medication from someone. And they should be somewhat familiar with the dosage that they're taking as well to make sure they're not getting too small or too high of a dose.
What about at home? What interventions would you teach to make sure that the medication is being safely taken at home?
Well, at home he should be able to self-administer. So we're going to want to make sure that he knows how to properly clean the area that he's going to be injecting. We also want to make sure that if he looks at the bottle, he'll be able to tell if it's expired, if there's something wrong with it. Regular insulin is supposed to be clear, so if he knows this and then sees that his particular bottle of insulin is cloudy, that's going to be an indicator that something is wrong and he shouldn't use it.
Okay. I think those are all the questions that I have for you for right now.
All right, let's go say hi to the patient.
Okay.
Okay, come with me. Hello, Mr. Ryder. Are you available?
Yep.
Hi, this is a level 1 student. Her name is Annie. She's going to be
Shadowing
me today and watching the medication administration. I know it's time to give you your insulin right now. Is it okay if she watches?
Yeah, that's fine.
Okay. And I'm going to go ahead and check your ID bracelet. Can you tell me your first, last name?
It's right of kind.
All right, and then your age or date of birth?
I'm 67 years old.
Okay, and your date of birth?
April 13th.
Okay, sounds good. So I'm going to go ahead and pull you up in the system. And I don't know if the tech told you, but your glucose that we just checked is 290, so that means we have to give you your insulin to help control that.
Okay.
So I'm going to go ahead and do that right now. Do you have any questions before I start?
No, I'm fine.
Okay, and where was the last place you got your insulin injected?
My lower left abdomen.
Okay, so I'm going to go do it on your lower right.
Okay.
All right. So I'm going to go ahead and wash my hands.
You know, they say you should clean it like you mean it.
Oh yeah? Is that what they say?
That's what I heard.
Who told you that?
I believe it was her instructor that was in here earlier, Miss Ann Morris.
Oh yeah, she's definitely a very smart instructor. Okay. I'm going to go ahead and glove up, and then I'll drop your medication. And how are you doing today?
Fine.
Just fine?
My team won the Super Bowl, so I'm happy.
Congratulations.
Yep.
Did you bet on the Super Bowl at all?
Well, that would be illegal.
Of course I would. Did you order your dinner yet from the cafeteria?
Yes, it is.
You did? Okay, good. Just because with this particular medication, you're supposed to have your meal within 15 to 30 minutes.
Well, I ordered it about 15 minutes ago, so it should be here soon.
Oh, awesome. Excellent. What did you order?
Salisbury steak.
Ooh, yummy. All right, I'm going to go ahead and scan your wristband. Make sure. Oh, didn't go in. Going to go ahead and try that one more time. Okay. And now we're going to go ahead and scan your insulin. Okay, and when you look at it, you want to make sure that it's clear, it's not cloudy, there's no sedimentation, anything like that. And you're going to check the expiration date. It looks like this is still good. So we're going to go ahead and scan it. Alright, and now, since we verified the patient, and we're going to go ahead and verify the dose. Let's see, 290 means he's going to get 16 units of insulin, and it's the right prescription order, and
290, 16 units.
Yep, it's 16 units for 290 for your glucose level. Okay, so what we're going to do is we're going to go ahead and draw up. These always get stuck for me for some reason. 16 units of air. Okay, and then you can come and see this. See how it's on the 16?
Mm-hmm.
Okay, and then we're going to go ahead and get our alcohol wipe. We're going to clean it like you mean it on the insulin bottle. That's just to make sure we don't contaminate anything.
Catchy phrase.
Right? It just rolls off the tongue. Alright. So I'm going to go ahead and inject the 16 units of air. And I'm going to go ahead and just flip it over and draw up those 16 units of insulin. Okay. And I'm just going to quickly scoop this back on there. And we're going to drag this closer to you so we can just chart. Okay, and you said that the last place that you got it was on your left lower abdomen, is that correct?
That's correct.
Okay, so I'm going to go ahead and put it on your right.
Now, what are the side effects and potential adverse reactions of this medication?
The side effects and potential adverse reactions of this medication are that if you give too much of the insulin, you could actually make your patient hypoglycemic, and that just means that you gave so much insulin that it's depleting the patient of glucose. So you're definitely going to want to monitor for that. Do you have any allergies that I should be aware of?
Nope.
I know you've been getting this at home, so you're probably not allergic to it, but it's
Nope.
always good to double check. Okay. So I'm going to go ahead and inject this into your abdomen. You're going to feel a little pinch. Yep, I'm just going to go at a 90-degree angle.
Okay.
And then we stabilize it. And then I'm just going to slowly inject it into you. And we just usually let it sit for about 5 seconds.
Okay.
All right, and then I'm going to put that in the sharp spots. Was that okay? Did it hurt?
Nope, that was
No?
fine.
Good. All right.
Now, how will you know that this medication's been effective?
Well, I'll know that this medication's been, tossing that in the trash, been effective. We're going to go ahead and redo the glucose check on him, and we'll also be doing periodic checks on him throughout the night just to make sure he isn't getting too high or too low of the glucose levels.
Okay.
Okay. Is there anything else I can do for you? Let me just give you your call light.
No, I could use a glass of water.
You can use a glass of water? All right,
Yeah.
I'll send the level 1 student to go grab that for you.
That would be excellent.
All right.
You want ice in that water?
Yes, please.
Okay.
All right. Thank you very much. So we're going to go ahead and talk in the hallway, but I know that you did come in here with some questions about nutrition and dieting.
Yeah.
So I actually have some pamphlets here that I'd like to give you, and as soon as you're done with dinner, we can go ahead and go over them if you have any questions.
Well, thank you very much.
This one's about the 1,800-calorie diabetic diet. We can also talk about the DASH diet, because I know that you're on a sodium restriction as well. So that could be something that you could think about. And then since you do have a foot wound and you are diabetic, I'm going to give you this pamphlet on diabetes and foot care.
Oh, thank
And
you.
that should be helpful too, just to sort of maintain the health of your feet. It's very important for diabetics.
Well, thank you for the information.
All right. And if there's anything else that we can do for you, just hit your call and we'll come running, okay?
Will do.
All right.
Thank you.
Thank you. Wash my hands again before I leave the patient's room.
Now, were there any pertinent pieces of information that you reviewed before administering the client the medication?
Yep. I double-checked with the client regarding allergies, their identification, where they had taken the last injection of insulin. I also talked to him and made sure that he was alert and oriented, that he wasn't confused or exhibiting signs of hypoglycemia. So you just give him a visual look, make sure he's not sweating or clammy or anything like that.
And why is that important?
Well, you don't want to give the medication if they are exhibiting signs of hypoglycemia, just because you would endanger the patient.
Okay. Did this information affect your decision to administer the medication?
It didn't affect my choice of administering the medication, just because it reinforced the fact that he was able to get the medication administered.
Okay. Did this information affect how you administered the medication?
The only thing that affected how I administered the medication was questioning him as to where his last place of injection was, just because if you inject it in the same spot too much, you can build up scar tissue, and that'll actually affect the effectiveness of the insulin when you're injecting it. It'll make it harder for the body to absorb. So.
All right. Well, thank you very much, Robin. This was very informative.
Anytime. All right. Good luck in level 1.
Thank you.